Hello, everyone. I'm Leandro Magalhães from Brazil, and we are talking here today on our second webinar about USP 800 hazardous drugs for healthcare facilities, about sampling procedures, how to sample, how to handle these drugs in the environmental. So I have here with me Jeff Spink, CEO of Analytics Corp, Andy Teague, our lab director and CIH, and Jack Simula, our client service manager. And today we are talking about these themes about sampling, but I think we can bring up what we talked in our first webinar, Jeff. So
sure, yeah.
We explained a little bit for them what is USP 800, who should cares about it, and so how can we summarize this for some people that may be watching this video and never watched the first one?
Yeah, perfect. Well, I welcome everybody into our second webinar on USP 800. If you didn't see the first one, what we did was a general introduction to USP 800, which is really a focused document on the cleanliness in the healthcare setting. We plan on doing a number of these, and today we're going to talk a lot about sampling and how we can help you with the sampling process. It seems to be the most commonly asked for question, right, Jack? Jack Simula is head of our client service area, and I think Andy is the laboratory director. That seems to be the question that we get asked a lot, right?
Yeah, it is, Jeff. We get a lot of inquiries about sampling and how to sample and what our kits are made of, that sort of a thing.
Right. So again, for those, this is the document. It's up on our website, and it's USP 800. The focus again is on cleanliness in the healthcare setting. And when you go through the document, I listed off the different sections. It starts out with the discussion of the hazardous drugs, types of exposure, which Andy's going to touch on in just a minute, responsibilities, engineering controls in the facility setup. That's a real big part of it. The clean rooms and just how the facility is structured. Section 6 is environmental quality and control, which is kind of where they discuss the sampling aspects of the program, which are a key component. And again, where we get asked a lot of questions on how do I do it? What do I do? Can you help me with this? The next section is PPE, the personal protective equipment that's required, communications, training, cleaning up after spills, SOP, and even medical surveillance. So I wanted to start out today the discussion on sampling to talk about the areas within the USP 800 chapter that they kind of lay out, and some of the areas that we've been seeing and discussing with our clients. First and foremost, we're finding out that when the actual drugs, the hazardous drugs, are delivered and received at the dock level in the receiving area in the hospitals or clinics, that the outside of the containers are contaminated right from the get-go. So I would start my sampling program with going down to the receiving area and doing a wipe sample or two on the outside of the containers to make sure they are clean. The next area within the chapter talks about storage and transportation. Again, if the if the container is dirty and you put it on a cart to move it, the cart could be contaminated. You put it into storage, the storage area could get contaminated. From there, what's going to happen is that you're going to move the drug into the pharmacy or the compounding area. And I think that's the area most people focus on when they're talking about sampling. Well, this is where I'm working with the drug, so I better sample this area, which is an obvious place to be sampling, but not the only place. Once it's compounded, once the drug is, say, put in the IV bag, it's transported up to the clinic area or to the floor where the person will receive the drug. This is another area that we're seeing a lot of issues. The nurses in the nursing stations could be exposed, and so some of our clients are doing wipe sampling where they administer the drugs, even at the bedside. Following that, the other areas that they talk about that we look at, of course, are spills. If there is a chemical spill, the cleanup occurs, and then sampling after the cleanup, and then lastly, the disposal of the drugs. So those are the main areas where your sampling program should be looking at. Those are the areas they should be looking at. And so now I'd like to have Andy spend 5 minutes or so just talking about sampling, wipe sampling, as is the case with the USP protocol, where you do wipe sampling, but also air sampling. And so let me turn it over to Andy.
The areas Jeff's talking about fall under the USP 800 because their concern is exposures through contact or exposures from the contaminated surfaces. The Section 6 of the USP 800 throws out some possible concentrations of concern on surfaces, and those are all important for controlling exposures from contact. There's also a component of the exposures potentially that's just very traditional industrial hygiene, which is airborne exposures. In handling, we see a lot of air sampling from pharmaceutical manufacturing. We also see it from pharmaceutical administration. We've seen samples from aerosolized dosing of patients, and somebody has to tend that drug administration and that patient. So those are relatively difficult exposures to control, to capture everything that's not part of the employees or the patient's effective dose. You also have, if there are, most of these pharmaceuticals are relatively high molecular weight. They're not really volatile compounds. That doesn't mean there can't be an airborne exposure from the handling processes, from crushing or preparing the drug and getting it into solution before you get it into solution. Right. So a lot of these things fall under very traditional industrial hygiene. An inhaled dose, that's a dose. It's easy to measure. The surface contamination is really a cleanliness measure because it's hard to figure out what contamination level on a surface is going to end up yielding what level of biological dose, what's going to actually be effective, biologically effective in a person. So we want to keep those surfaces clean and monitor the cleanliness of the process. The sampling is a tool to make sure the process is under control. But we also do have the wipe sampling, which ties into the USP 800, because again, cleanliness of the surfaces is an indicator of how well the process and the handling is controlled.
Hey, Andy, for the audience that may not know, could you just touch on the air sampling for another minute? How do we go?
How do you accomplish it?
Yeah.
The air sampling is conducted much like you would in a manufacturing environment. You use a battery-powered belt-mounted pump to draw air through typically a filter, for these drugs, for these chemicals, to draw air through the filter and trap the contaminant as a particle from the air and sample in the breathing zone. Excuse me. In the breathing zone, and by knowing the sampling rate, you can determine, and testing the filter for the burden of aerosol that's collected of the chemical, you can figure out what the effective air concentration of exposure was. And based on extrapolating what a employee breathes in the course of a day, the amount of air they process, you can come up with a rough estimate of the dose. And these pharmaceuticals have well understood, the pharmacokinetics are well understood. What constitutes biologically effective dose is that's the basis of the use of the chemical as a pharmaceutical.
Yeah, that's a great explanation. I think, as you touched on, we see a lot of air sampling for pharmaceuticals. Typically, they occur in the pharmaceutical manufacturing process. Mm-hmm. So the people that are working on the actual manufacturing of the drug are being tested to make sure that they're not being exposed to the API or the active pharmaceutical ingredient.
I think in the manufacturing environment, there's already a good understanding of what dose potentially that process and exposure constitutes. There's a less good understanding that generating an aerosol of that drug in a clinical setting can also generate an airborne inhalation dose.
Yeah, it's really interesting that we're talking about this because it was just a couple of hours ago, I talked with one of our clients that is doing air sampling for platinum drugs. And I found it really interesting. I'm going to diverge for just a second, tell you about it. It's evidently a lot of the folks that worked on the 9/11 cleanup are now experiencing lung problems, which you can well imagine. And so our client is working with a hospital in Florida to monitor for platinum in the air because they're doing a procedure now where they treat the patient's lungs with this drug. And they actually, I guess, build a tent over the person that they're operating on to make sure to contain the aerosol, right, Andy?
Difficult to, the platins are not they're not particularly volatile, but if you want to administer it, by inhalation, or if you want to administer it, I guess even by surface application in a very homogeneous fashion, you have to generate an aerosol.
Yeah.
And the aerosol then becomes an issue for control and for exposure of people other than the patient.
Yeah. So in the end, what they're going to do, Leandro, they're going to do wipe sampling for platinum drugs after the procedure is done. But while the procedure is done, they're going to have the nurses and doctors wearing personal, pumps and being checked to make sure that they weren't exposed. And
it's traditional industrial hygiene there.
Yeah.
Sure. And let me say this: I believe this is going to become more and more of an item. And at Analytics, we have the pumps. Jack, would you talk a little bit about our pump program for just a minute, where we can support this process?
Yeah, sure. Jeff, we have a personal sampling pump program that is free to our clients. And when we say free, it means they don't pay any rental fee for the pumps. They pay for shipping the pumps back and forth. And what we do is we provide the personal sampling pumps, the media that they need to do their samples. We pre-calibrate the pumps for them and send it out in a nice kit that includes rotometers for field calibration, all the tubing that they need to do the sampling. And once they finish their sampling job, they pack it all back up in the case, ship it back to us along with their samples, and we take it from there.
Right.
Yeah.
And so that kind of leads into the next discussion. Who's going to do the sampling? We know that we got to do USP 800 sampling. It went into effect December 1st, 2019. We're getting a lot of calls on, hey, I got to start sampling under USP 800. who can I get to do it? And I think I touched on this a little bit in the previous webinar, but I wanted to go through it again and then lead into a discussion that Jack's going to have here. I categorize it into three groups. The first group would be a group that I call CETA, the Controlled Environmental Testing Association people that have gone through training and testing. And this is the group that typically goes in and works on the clean rooms. They work on the hoods, they work on the biosafety cabinets, either installing, building, or maintaining along the way. I believe they go in twice a year to inspect everything to make sure it's properly working. They maintain the filtering system, put in new HEPA filters if it's needed. And again, a great group of people that you can call on to do the work. It's CETA, C as in controlled, E as in environmental, T as in testing, and A as in association. The corporate office is in Raleigh, North Carolina. If you look them up on the website, they have a directory of people. Whatever area that you're in, you can find really qualified people in that area. The second group is really a group that we work with a lot, and that's the consulting business. Typically industrial hygiene consultants, CIHs like Andy, that have been trained in the whole process of writing a program. Where am I going to sample? How am I going to sample? When am I going to sample? The whole entire program they put together for you. They typically come out and do the sampling, collect the samples, send them to the laboratory. We do the analysis and then send them back to the consultant who interprets the results, writes a report, and presents it to the client. That's the second major category. And, everybody jump in if you want to add anything to that. The third group that I call it is the do-it-yourselfers, the people that do it themselves. And it's happening a lot more. Typically in a pharmacy or in a healthcare setting, someone will be designated to do the sampling. And we can work with that person closely. We have all of the materials. If they wanted to do air sampling, as Jack said, we can set them up with a pump. Or if they wanted to do the typical wipe sampling, which is what's called for in the USP 800 regulation, we have a free kit that we can provide. And Jack, would you kind of go through the kit, explain the different parts and pieces, and exactly how and what they're all used for?
Sure thing, Jeff. First, we I don't know if anybody can see us. We finally have our new kits on in-house for shipment out to our customers, and we've sent out quite a number of them so far. And the best thing about our kits are that when you call in to order it, they're completely customizable, and that means you just tell us what you want. For instance, I want one kit, and I'm going to take 14 samples. So what we'll do is we'll customize it. We'll put 14 sample sets in there. And the sample sets include 2 swabs, one for doing when you go over the sample with DI water, the wet part. And then the second swab, you go back over the same area again with a dry swab. You put it in a tube, and then you send it into the lab. Besides 2 swabs, we have a pair of gloves in every sample set. So when you finish taking one sample set, you can discard those gloves, and when you're ready to do your next one, there'll be a fresh set of gloves in that sample set. There's a water vial in each sample set, and there's a tube with a label in it. So each sample set is separate and ready to go for you. And along with the kits, you also get a 10 by 10 centimeter template if you're going to be doing surface sampling and you want to take a 100 centimeter square area. You don't need to use it if you're doing things like sampling doorknobs or telephones or
Irregular
that are hard to
surfaces.
measure. There's also a chain of custody in your kit. There is a set of sampling instructions that covers, step by step how to do your sampling, and a prepaid shipping label for return back to the lab. And our kits, like Jeff said earlier, are free. We don't charge anything for use of the kits, and you can have the kits customized, to hold as many samples as you wish.
Great. Hey, Jack.
Just to mention, if anyone want to see the procedure here, we have a video on our channel on YouTube. They can check it out, and we have Jack showing them how step by step how to sample, how to fill the chain of custody, everything easy to understand and a step by step.
Yeah, thanks, Leandro. That's right.
Yeah, I would recommend the video. It goes into a lot of detail. But for this purpose of this discussion, I want to just kind of go through it one more time. In the kit, you get a small ampule of DI water, right?
Yes.
And that DI water, you wet the white sample with that, right?
Yes, sir. Yep.
Okay. Do you use that same DI water for the next set of samples, or is there a second one? Or
no, every sample set every sample set will have its own fresh DI water. So you're going to have a different vial in each set. So each sample set will have 2 swabs, a vial of water, a pair of gloves, a tube to put your swabs in after you take your sample. And also included are 10 by 10 centimeter templates, chain of custody, and return labels.
Yeah, and there's a label that goes around the tube as well, right?
Included in the sample set is a label with the tube, right? So you can mark on the tube your sample ID number.
Right. And I think it's important for the people, Leandro, to remember to truly change the gloves between sampling events to avoid any cross-contamination. Andy, you want to talk about cross-contamination for just a minute?
The main thing I would tell you is make sure you get enough kits to practice a little first.
Yeah.
You've got a variety of manipulations to manage. So I recommend that you watch the video, read the instructions, but I recommend you run through this a time or two before you worry about trying to collect a real sample. And the manipulations that are required will become more, they'll become easier. They'll become more, with practice, they'll become more easier to accomplish. That's my main recommendation. You're moistening the swabs to try to improve the efficiency of room. All the studies say dry swab is not the best way to recover a material from a surface. A swab moistened with a suitable solvent increases the collection efficiency from a surface greatly. So that's why we're working with a moistened swab. And we're working with a moistened swab one way, flip it over, swab the other way, and then come back and repeat that with a dry swab just to try to boost the efficiency. The efficiency of recovery from the surfaces really varies, not just by the compound, but it also varies by the type of surface. And it's very common in an operation of very much size to have a variety of surfaces: stainless, floor tile, corian. It's a big variety, and recoveries vary. So we're doing a multi-step to try to improve the efficiency.
Good explanation. I really emphasize, though, the idea of doing one at a time. Open one sample set, put on the gloves, crack open the water, put it on the swabs, do the wipe, finish that whole entire procedure, take off the gloves, take off the water, put it back, throw that out, and then go on to the next one, because we certainly don't want to analyze 10 or 12 samples and and find the drug that was in the first sample carries through to the other samples. So that's really important. Now, the other thing I wanted to touch on right now was shipping of it, Jack. Could you just remind everybody the procedure that goes on there?
Sure, Jeff. Once you're finished your sampling and you place your sample vials into the Ziploc bags that were provided with the kits, you put them back in the same box that we shipped your sample media to you in. And on the bottom of the box is an area for attaching your FedEx label. And the label is provided free of charge. Just place that on there. You close up the box. It seals up really good without tape, but you can either tape it or not tape it, and then just drop it in FedEx, and we'll get it the next day. And after we receive it, within 3 to 5 days, we'll have a report ready for you, and a report ready. Yeah, a report to you within the 3 to 5 day time period.
Yeah, and the other thing is you can call FedEx to have them pick up the box or take them to your shipping and receiving area.
Right.
Dropbox.
However, and then the report will come via email, right?
Yeah, PDF copy of the report will be emailed to you. There's a place on the chain of custody where you will write in your email address, and that then we're able to send it to that email. We also have the ability to kind of hardwire your email address into our system, so that whenever a report's generated for your account, you'll always automatically get an email of that report.
Great.
Maybe Jeff, have maybe something someone is doesn't know, but we should cover that. But is there any stability of the sample? How long they can storage the sample before sending to the lab? Do they have to ship it cold? Maybe it's something that someone is watching us. They don't know. It's the first time they are doing that.
Yeah.
Is there any? They have to take care about these procedures, how they can handle that, how long they can wait until they send the samples to the lab.
That's really a good question, Leandro. We have done stability studies, and we have found no need to refrigerate the samples.
But I'll tell you, Leandro, we want everybody to expedite. Don't sample and hold. Sample and get the sample. That one of the reasons we went with FedEx shipping is to minimize the concern about the delay during shipping and the time stored out of they're stored at ambient temperature. We don't want them to go in the mail and take an extra week.
Right.
So we want to expedite things as much as is feasible.
Okay.
And when possible, we recommend sampling on Monday, Tuesday, Wednesday, Thursday. You sample on Friday, they're gonna sit over the weekend in FedEx. So in some cases, but to really answer your question, we've not found any need. Now the box is large enough for us to put an insulated an insulation inside the box and a ice pack if you feel that you'd like that, or if we think it should be, depending on the drugs you're doing. But at this point in time, we don't refrigerate. We overnight, and we ask you to do it as quickly as possible. I mean, if you're going to sample on Monday and Tuesday, no problem holding them and shipping them on Tuesday. But if you're going to sample on Monday and then say Thursday, I would go ahead and send the Monday shipment, and then on Thursday send the next shipment as well.
That's a good answer.
Yeah. So with that, if anyone has anything else they'd like to add, in the next webinar we're going to discuss getting your report when Jack sends the report out, interpreting the report, how was the analysis done, kind of a walkthrough of the lab from the time we receive it till we give you the results, what goes on, and then we'll go on from there. But at this time, I think we've covered the sampling and shipping of the samples. I would highly recommend that video that Jack put together, and again, please call Jack. Give him the number if you would, please.
Sure. Our toll-free number is 800-888-8061. And you can dial 1 for customer service, or you can dial my extension directly, 5108.
And I think you'll see that 800 number plastered all over the collection box as well. So it's pretty clear. So with that, I thank everyone for their time, and we look forward to the next meeting in a week or two. In the meantime, we're going to be sending out a couple of other things to watch for, and any questions or anything you need on USP 800, we're here to help you.
That's it. And if you want to check this video, we have a link here on the description of this webinar, and feel free to contact us. See you guys in the next webinar.
Take care, everyone.
Thank you.
So long.